In this episode, I'm going to show you how to fix a pinching pain in the front of your hip when squatting.
I want you to have the capability to fully move the way your body was designed to, right?
Drop of a hat, I'll take you back to where my problems lie. In trouble, younger daughter done some that made my mama cry. Out to the heavens like I bless him, for I know he's lost. Caught in a trance and this manic depression settled in. Living in the fantasy.
Hey, what's up everybody? I'm Dr. Horschig from Squat University, and this is episode 9 of the Ask Squat U show. Hope everyone's having a great week so far. I'm about to head out on a small vacation, first time this summer. But before we go, let's get into a show. Let's get to today's question.
Bresson's World asks, hip pain when squatting? Like a pinch next to the hip bone. I stretch out my hip flexor a ton, and it's not helping.
Alright, so today's topic is how to take a pinching sensation away in the front of your hip in the deep squat. Now, in order to really understand how to fix it, you need to understand what's going on in the joint itself. When you go into a squat, your femur is moving in your hip socket. Now, outside, this motion looks like this. It's coming up. That's the motion of flexion. Well, deep inside your hip, your femur is rotating in the socket called the acetabulum. Now, in order to get into a deep squat, your femur has to rotate a good amount. Well, if you feel that pinching sensation, what you're actually feeling is the femur hitting the front of your hip socket called your acetabulum. Now, this is called a couple different things. It's called AIS, acetabular impingement syndrome, or FAI, femoral acetabular impingement. What we're really talking about is the femur hitting the front of the acetabulum. Now, this can be caused by a couple things. The main issue is stiffness in the hip capsule itself, which is basically the connective tissue that surrounds the actual joint itself. Now, if it happens to enough extent, it can cause sort of bony changes. Basically, you've rammed into the front of your acetabulum so many times, the body eventually develops more bone around that area as a compensation. Now, this can happen on the front of the rim of the acetabulum or on the actual femur itself. This is called a pincer or a cam impingement. This is not good because eventually down the road, it can lead to actually changes in the labrum, like a labrum tear. So we want to be able to improve how your femur moves inside the hip socket in order to take away this pinch. Now, stretching alone will not fix this issue. We have to fix how the joint is actually moving in the capsule itself. And this has to be done with banded joint mobilization. So that's what I'm going to show you today. Specifically, we're going to focus on the posterior and lateral part of the hip capsule, which is often the most stiff area that causes the femur to glide forward early and hit that acetabulum. So let's talk about how to fix it with banded joint mobilizations. So the first way that I'm going to show you to affect the stiff lateral parts of the hip capsule is with a distraction. You need to use a band. Now, you have to use a heavy band because you're actually needing to apply a lot of pressure to get some change in the capsule itself. So what we're going to do is step into a band. You're going to get it up pretty high in your hip joint. Get a good amount of motion away from there. So we're pulling laterally, distracting the hip inside the joint. Now from here, what you're going to do is 2 different motions. The first is internal rotation. Now for most people, when they get that hip pinched, they are getting it because their body is unable to get flexion with enough internal rotation. So basically that's the motion that causes the pinching sensation. So from here, because we're laterally distracting, we're pulling the hip away from that pinch. By pushing into it, sometimes we can get just a little bit of motion that is not causing that pinch anymore. So we're mobilizing into the position of what was causing that pinch before. From here, we're pushing about 10 times in and out, and you should feel a good stretch in the lateral part of your hip. And you can also go external rotation. So from here, driving out to the side, maybe about 10 times or so, or you can just hang out here. From here, we're going to do about 1 to 2 minutes of pushing in. Now, if you're getting a little bit of pinch sensation with the internal rotation, I want you to get maybe just a little bit more pull. Here, pushing in and then pushing out, okay, for about 1 to 2 minutes. Now again, after every joint mobilization, you want to recheck your squat and see if you've affected it in the way you want, because we don't want to do any joint mobilizations that's not really effective. So from here, we're jumping out, we're retesting our squat. Am I able to get deeper without that pinch sensation in the front of my hip? If so, that's the correct mobilization for your body. Now we also need to address the posterior fibers of that hip capsule. Now, when those are stiff, it causes the femur to start in an already forward position. which means as you go into your squat, it leads to a greater inclination of that impingement early on in the squat. So by stretching out the posterior fibers, we cause that femur to sit a little bit more even and decrease that pinching sensation. So how do we fix that? Well, you're going to get into that same position before, but instead of having this forward position, we are going to drive our knee into the ground like this. What this is going to do is this lateral distraction is going to help mobilize the hip to the side, but we're also going to be putting pressure into the femur, and that's going to push the femur into the back of the hip capsule, into those stiff fibers, and stretch them out a little bit. From here, we're going to plop our foot to the inside into a little bit of external rotation. Now from here, I can lean to the side, I can just hang out here, and I'm feeling a good stretch in the back of my hip. From here, I'm going to do this for about 1 to 2 minutes. I can also do a little bit of internal rotation, but from here, I'm just going to hang out, feel a good stretch, and then again, recheck my squat and see, can I now get into a little bit of a deeper position with less impingement in my hip? And if so, that's a good mobilization for my body. So another question I often get on this topic is, can I do an anterior joint mobilization to take away that pinch? Let me show you what that looks like, and we'll talk about why you should not do that. Now, let's get the band around the hip. We're gonna get a good amount of tension on it. Now from here, what we're doing with this band is forcing the femur forward in the acetabulum. Now, why is that not helpful for taking away the pinch sensation? Well, what we're focusing on here is hip extension. Now, if someone is a runner or maybe needs to get a little bit more hip extension for the bottom of their split jerk, this can be very helpful, because what we're doing is we're gliding the femur forward into possibly some stiff anterior capsule and helping improve extension. However, the problem that causes that pinch sensation in the bottom of a squat is a flexion issue. So this mobilization will not address the problem of what is causing the pinch sensation in the bottom of the squat, which is the tight posterior and lateral capsule of the hip joint. Okay, so now that we've taken away that pinch sensation in the front of the hip with the proper joint mobilization, we then need to address your squat mechanics. Let me explain. Now, whenever you go into a squat, we get a little bit of a hip hinge, and then you're squatting down. Let's say we're doing a front squat. Now, if you have a very anteriorly tipped pelvis, it looks like this. We call that the Instagram model squat. The reason we don't want to do that, besides not getting a ton of likes on our Facebook or Instagram posts, is whenever you tip your pelvis forward, your femur naturally is going to glide a little bit forward in the acetabulum. And as you go into your squat, it can lead to a greater inclination of that hitting in the front of the acetabulum earlier in the motion. So if you're tipped forward and you squat down, if you have that problem, that pinch sensation, you're going to get it here instead of way down at the bottom of the squat. So in order to fix that, we need to stay in more of a braced neutral position. So from here, before you start your squat, you're going to think, brace your core, squeeze your glutes. That's going to create a neutral pelvis or a very, very small extended position. And that's going to center your femur in the acetabulum. I always think, brace your core like Mike Tyson's going to punch you right in the stomach. From here, then go into your squat. So if you overextend early on, arch your back a lot, tip your pelvis forward, it leads to a greater inclination of that pinching sensation early on. So we have to be able to address the problem with the proper joint mobilization, but also affect your squat mechanics so that the problem doesn't come back. You can't just treat one and then think it's automatically going to fix your squat. If you squat with bad technique, the problem's just going to come back. So there you have it. Question of the day. How long does it take you to warm up prior to your WOD, prior to your training session? Personally, it takes me about 15 to 20 minutes, but I want to know your answer in the comment section below. Hope you guys liked today's Ask Squat You show. If you did, please share it with your friends. Please subscribe to my channel and keep those questions coming. Happy squatting, everyone.
Hometown hero on the road doing shows and sold out arenas. You can call me what you want, but you won't ever slow my dreams up. This is the vision of a dreamer. I seem to